The fourth test I will demonstrate is the Thompson test, which assesses for potential Achilles tendon rupture. The Achilles tendon helps produce plantar flexion or pushing the foot downward. To perform this test, I have the patient lie down with their feet hanging off the end of the table. The fourth test I will demonstrate is the Thompson test, which assesses for potential Achilles tendon rupture. The Achilles tendon helps produce plantar flexion or pushing the foot downward. To perform this test, I have the patient lay down with their feet hanging off of the bed. I squeeze the calf muscle firmly, and in a normal intact Achilles tendon, the foot should automatically plantar flex. When the calf is compressed, which you can see in the video, the foot moves as I squeeze the gastrocnemius in the lower leg. A positive Thompson test is when the foot does not plantar flex at all during the squeeze. This indicates a complete Achilles tendon rupture, which is a medical emergency and often requires surgery. The last test I will demonstrate is the dorsiflexion external rotation test, which is also known as the Cleager's test, which is used to assess high ankle sprains as well as injuries due to the deltoid ligament. This test helps evaluate the integrity of the structures to stabilize the ankle, especially the distal tibiofibular syndesmosis and the medial deltoid ligament. To perform this test, I have the patient seated with their knee flexed to 90 degrees and their ankle in a neutral or slightly dorsiflexed position. I stabilize the lower leg with one hand, then externally rotate the foot with the other hand, and after I externally rotate the foot, I try to apply dorsiflexion to further stress the syndesmotic tissues. A positive dorsiflexion external rotation test occurs when the patient reports pain at the distal tib-fib joint, which suggests a syndesmotic injury, or pain along the medial ankle, which may indicate damage to the deltoid ligament.